Understanding diaphragmatic breathing.
Diaphragmatic breathing, also called abdominal or belly breathing, engages the muscle beneath your lungs, the diaphragm. Unlike shallow breathing, which uses the chest muscles, this method promotes deep, full breaths. Practicing diaphragmatic breathing can help calm your nervous system, lower stress, and improve overall mental well-being.
Why it benefits your mental health.
Deep breathing slows your heartbeat and stabilizes blood pressure. This activates the body's relaxation response, reducing anxiety and promoting a sense of calm. Over time, regular diaphragmatic breathing can help manage symptoms of stress, depression, and anxiety, making it a powerful tool for emotional self-care.
A step-by-step guide to getting started.
Start by sitting or lying down comfortably. Place one hand on your chest and the other on your belly. Inhale slowly through your nose, letting your belly push your hand outward while keeping your chest still. Exhale through pursed lips, gently tightening your stomach. Repeat for several cycles, focusing on the movement of your belly.
Tips for making it part of your routine.
Aim to practice diaphragmatic breathing for 5 to 10 minutes daily. Choose a quiet time, like upon waking or before bed. Draw your attention back to your breath whenever you feel stressed. With practice, this technique can become a simple, effective part of your self-care routine.
Bringing mindfulness into every breath.
Combine diaphragmatic breathing with mindfulness by noticing thoughts, sensations, and emotions as you practice. Don't judge or try to change them. Just observe. This mindful approach enhances the benefits, helping you reconnect with your body and strengthen emotional resilience over time.